right, Dr. Pierce. I wanted to do this because I have been growing a lot, great, viewers online, and I think the channel have a little bit of everything, have a little bit of training, have a little bit of nutrition, but I think what's lacking a lot in the industry is the real knowledge from people like yourself that come from sport background and the medical background.
Mhm.
So, as a power lifter yourself, and having people here in the clinic too that worked with professional bodybuilders for so long, I think it's such a common subject for you, but also for a lot of people in the sport of bodybuilding in particular, but any other sport, they have a little bit of a gap speaking to their providers because if they say, I'm on a diet, particular diet, or I'm exercising, and the doctor doesn't know exactly what they're looking at on the labs and understand that, some numbers might be elevated or decreased because of the amount of exercise they are doing. So then how can they really get an assessment on their health, right? So what I wanted to do is to have everybody to know that they can reach out to you, they can come to the clinic,
Mhm.
become patients, and do things a little bit more, the way that it should be done with an assistance of a provider who understands what they are doing. So I'm gonna go before we start. I would love for you to give a little background of your career as far as not only a doctor but in sports too, to have a little bit more relatable to everybody who's listening. And then I would love for you to answer some questions that I got.
Beautiful. Well, um, I had so many thoughts as you were saying that, and you want me to talk about myself, so you kind of throw me off a little bit. But I was, started working out, lifting weights, and doing stuff about 5 years old. My
Wow.
older brother, had me trying to do pull ups, and I could do a couple pull ups, and then he said, "I want you to do three, and I'll give you a Pepsi." And I was hanging there after two. I did two, and I was saying I can't do it, and so he looked around and grabbed the first thing that he could grab, and he grabbed a fondue fork, those long skinny forks, and act like he was going to stab me in the butt with it. And I pulled myself up, and he goes, "Look, you just learned that that word doesn't exist. You can do anything that you put your mind to. You put your mind to pulling yourself up."
That was
So
a tough love.
yep,
Yeah.
yep. But I figured things out from there, and I, started working out, and I could do push-ups, and I could do all kinds of, push-ups on chairs, and go down and touch my chest to the floor and roll my wrists and come back up. I can imagine doing that now. And then I got involved in high school with, actually a little bit before high school, lifting weights, and I kind of developed a passion for that. I found that I was just naturally stronger than everybody else. And so I got into lifting weights, and I didn't know what powerlifting was, but I just liked picking up heavy weights.
Mm-hmm.
And then fast forward, I joined the military after high school as a paratrooper in the U.S. Army, and I was lifting weights on my off time. You do a lot of running, a lot of running.
Yeah.
And I was stationed in Central America, so we spent a lot of time in the jungles. And so it's not a great place to put on a lot of muscle, but I did the best I could. And I spent a lot of time in the gym lifting. And I actually had a coach there who was on the Army powerlifting team.
Oh.
And he taught me a little bit about powerlifting.
Uh-huh.
And then his advice to me at the time was, well, with your build, you should probably consider bodybuilding because you kind of got narrower hips and you're not going to be able to squat a ton. You're not going to be able to deadlift a ton. And I just went, I'm not going to listen to that because I could bench more than everybody. So I just figured I would do that. And I, competed in powerlifting, primarily in the bench press, but I, and just tried to continue to lift as heavy as I could.
Mm-hmm.
And I did it all the way in through med school and into residency. I can't remember my last competition was. I think it was in med school. And then it just, I continue to enjoy lifting, but I just quit competing because my focus was building a practice.
Yes.
And taking care of patients.
Mm-hmm.
And, that level of competing takes a lot of effort and time, just like this level of bodybuilding.
Mm-hmm.
And it was just something that I took as more
measure priorities.
Yeah. And it was just more of a hobby. I wasn't making money doing it. You know, and so that's kind of my background there. I played, you know, I swam as a kid. I was, you know, competitive on a swim team.
Mm-hmm.
And I played high school football, and I played a lot of, you know, baseball and basketball growing up, but not at the high school level. And then I never played college sports because by the time I went to college, I was 27 years old. I had monkeyed around. I played semi-professional football when I moved out here to Las Vegas. So I did a little bit of that. And then around 27 is when I pulled my head out of the sand and said, all right, can't work in nightclubs anymore. I don't want, you know, let me start focusing on a career and
That's where
found medicine.
That's
Right?
where the JJ comes from, right?
Yeah,
Vegas.
from when I first, yeah. Well, it actually came from my mom's dear friends down south in North Carolina. And when I was just a little boy, they're like, "That's JJ," and that kind of stuck, you know. So,
Okay.
but so that's kind of my background in sports, and then in medicine. I mean, I knew I wanted to do something like this before I even made it to med school. It was one of my friends and mentors, and the actual person who developed Ageless Forever and turned it over to me, Dr. Julio Garcia. When I was I was considering med school. I wasn't even applied, and I went to him and talked to him about it, and he's like, well, you know, gave me some advice, and he said, you know, this is an area that you should go into. And at the time it was, and it's still called anti-aging medicine. I don't like the term. Age management, I think, is a little bit better. I've heard functional endocrinology, whatever you want to call it, but it was more a health-based approach to medicine. And that's what really drew me to it, as opposed to the disease-based approach that we still currently have. And we need to, you know, the whole medicine paradigm needs to shift towards a health-based approach. But I am on the forefront of that doing this, and it just really spoke to me. And I knew a lot about hormones because while I was doing that competitive powerlifting, I make a silly joke, but I think all doctors are nerds to some degree or another. And then all nerds generally fall into one or two camps, either a Star Wars or a Star Trek nerd. And I use the Star Wars analogy because, you know, when I was competitive as a powerlifter in my 20s, I know the dark side of the anabolic world. Because people would say, oh, what are you taking? And I'd say, well, let's talk about what I'm not taking because the list is probably smaller.
I'm glad that he's honest.
You know?
Yeah.
And, you know, so I learned about it there, and that knowledge, when you have it, right? So it follows you through med school, and then you start hearing what they're saying there, which unfortunately was a lot of misinformation in medical school about hormones that we've since learned that was just nonsense, and still pervasive today. You still hear doctors saying silly things that have been parsed out through the literature, and we know they're not true. They still say it. And so that kind of goes back to your point where, you know, an athlete's going to do something and they go to their doctor with it, and then their doctor spouts off something to scare them that's not, in a lot of instances, backed by the medical literature. So it's nice to empower people. And I like that you said, you know, hey, people can come here. And yeah, they can come here, and I welcome people to come here. But let's really look at this as a way for me to empower you, the listener or watcher of this podcast, to ask the right questions. And then hopefully you can get your physician to follow. And in today's world, you can get a lot of these labs on your own. You don't need your doctor to order these labs. And so I don't recommend that you treat yourself, but if you're not getting the help that you need, you can get a lot of answers on your own and just ensure that you're not as bad as somebody was saying, or you're not hurting yourself. And I think that is really the thing, is to really empower people, because there's a lot of information, a lot of tools available to people now that weren't there 2 years ago, 5 years ago, you know?
And I feel like the demographic of bodybuilders in particular, they are so curious about the human body in general that they are the ones that are learning how to read their own labs.
Well, I mean, there's a lot of bro science out there, some good, some bad. But I will tell you, some of the protocols I use came from bro science. A lot of doctors, because some of this stuff wasn't known. Fortunately or unfortunately, the bodybuilding community goes out and they make guinea pigs of themselves and
Yeah.
we learn really good stuff, and
So
we learn
much.
really, what not to do.
Mhm.
But so yes, that, the bodybuilding world. Listen, and somebody said this to me when I was in my undergrad, and I was about 260 pounds, and walking around the campus of UNLV, and I was taking, I'll never forget it because it was a genetics course over the summer, and I was standing out front of the classroom, and somebody comes up to me and goes, "What kind of grade are you getting here?" I'm like, "I'm getting an A." Like, it's just studying for the MCATs, and I need to know this stuff. And they're like, "But like, how are you getting an A? You're so big. You're not supposed to be that smart." Like, and they were serious about it. And I was like, "Well, I'm sorry, I really can't explain it to you because you'd be too ignorant to understand when you ask me that type of question." Like,
because they associate
they associate the muscle. I mean, it's that perception. And I'm saying that point because
all that you do is to go to the gym. So how
Right.
would you ever know? Because how would you have time to read?
Yeah.
Because you're in the gym for 10 hours.
Right. Yeah. And so I'm saying that because I felt it, and there's a ton of people that may or may not have a formal education, but their knowledge is extensive, right? And because there's so much information out there, but you just really have to look and be careful where you're getting your information, because there's a lot of misinformation. Doctors get a lot of misinformation too, so just be careful. That's I think the main point that I want to make.
Yeah. But let's go towards a few questions here that I got online, and some other ones too that actually friends of mine who are, I would say, the best bodybuilders out there in nowadays, they also had those questions. So I'm going to start with, what are some of the common hormonal imbalances that a female bodybuilder can have due to maybe a little bit of an extra production of testosterone for not only using testosterone but for training so hard and all the things that is necessary to build that kind of muscle?
Well, I think there's a little dichotomy that you have to consider. One is, are they supplementing with testosterone, or are they natural? And natural then takes you more to even athletes, right? So it doesn't have to be bodybuilding, right? So in the natural side, a lot of women, because of the leanness that they get, they'll become amenorrheic. Generally, they're unable to ovulate, and it's due then to a lack of estrogen. So there's the signal isn't coming from the brain to go to the ovaries to cause an increase in estrogen, which causes ovulation, which then leads to menstruation. So why is that? And I don't know that we really know the answer, but I think it's the body's preservation, because it says, well, I'm this lean, I don't have enough fat. It would be difficult. It's a survival mechanism. It's difficult to carry a pregnancy. So because the primitive brain is thinking there's starvation. Right. And so it doesn't allow for that, because that, women typically have more fat than men. Why? For pregnancy, to have that energy to feed the fetus through development, even in a time of starvation. So I think there's that aspect. And then when you go and you augment with hormones, even in men, for injectable testosterone or any derivative thereof, the body perceives the testosterone, and it has what's called negative loop feedback or inhibition. And what happens is that little bit of testosterone feeds back to the brain. Brain goes, oh, too much, and it shuts down the signals to the pituitary that produces FSH and LH. So it shuts down gonadotropin releasing hormone, and then that sends the signal to pituitary from the hypothalamus to release LH and FSH. Now, LH and FSH go to the gonads, either the testicles in men or the ovaries in women, and they will both of them, LH increases estradiol and testosterone, and FSH helps with eggs and sperm production. So, but that feedback loop gets shut down, and so both sets of gonads get turned off for the most part, like 95% of the time or more, right?
When we add
when you add the
The-
exogenous
Mhm.
hormone, right? So now a woman is imbalanced because now she has no estrogen, no progesterone. The only estrogen that she will probably make will be from the aromatization of testosterone
Mhm.
to estradiol. Generally, that's a rate of about 3 to 5%.
Mhm.
It's an insufficient amount of estrogen for a woman, in my opinion,
Mhm.
and for and that's a normal amount for a man, right?
And I would love to tap into, since we are talking about estrogen, that is one of the questions here is why is that estrogen is so important for women? Because we do know, and I think that's something that is very popular right now in the industry, women talking about, the abuse of anti-estrogen during their preparation for a bodybuilding competition. And why would that be so detrimental to their health? Because we keep on hearing over and over again of even female bodybuilders now having to retire because their production was so low that they can come back from it even
Well,
now.
they've shut their system down, and sometimes that becomes permanent, right? So a woman is born with a finite amount of eggs. Um, by the time she reaches menarche, or the time of the first menstrual cycle, she's already lost maybe 60% of her eggs and never even had a period, right? This is just the normal thing that happens. And so now she has about 40% of her eggs to carry her out through the rest of the lifetime. When you shut that down over a long period of time, that may not come back, and those eggs may just kind of atrophy and maybe go through apoptosis. They're not supposed to be there for a long time. So they're putting themselves into kind of an early menopause. Now, sometimes they can come back from that, but a lot of times they can't. And we can see this in some imaging studies, because they will go get an ultrasound or something, and they'll say, oh, the ovaries are there, but they're atrophic or small. They've shrunk because they're not getting stimulated by FSH and LH, because those hormones have been inhibited by the steroid, or the anabolic steroid, right? So then what is important about estradiol? Well, and let's just keep it simple. If you think of a menopausal woman who's never had any hormone therapy, what do they start suffering from?
Mm-hmm.
Well, you see an increase in fat.
Mm-hmm.
We see increase in coronary artery disease, because
Mm-hmm.
estradiol really protects the coronary arteries.
Mm-hmm.
And we'll come back to that. We see increased risk for bone fracture, because estradiol, believe it or not, is, from the studies that I've read, is more important than testosterone for bone density.
Mm-hmm.
Increased risk for dementia
Alzheimer's.
of all types,
Mm-hmm.
right? Alzheimer's, one of them.
Yeah.
One of the things that a lot of women come to the office with, and it's a sign of menopause, perimenopause, frozen shoulder, achy joints, right?
Mm-hmm.
Estradiol helps prevent that. You give their estradiol back, it's better. High cholesterol, which potentially can lead to heart disease. But I've seen a lot of women, they've had normal cholesterol their whole life. They start to go into menopause, their cholesterol rises. What is the first thing that their doctor wants to do? Oh, here's a statin drug.
Statin, yeah.
Why are we going to do that when fix the underlying issue? It's lack of estrogen. So
Another thing too, Doc, that I think is important to mention, two things now that you told me about estradiol and fat gain, which it's so common to see post competition, right? Well, not only your hormones, your hunger hormones, leptin and ghrelin, are completely imbalanced, so you're just eating everything in sight, but then you're coming from weeks of potentially taking anti-estradiol. Then it's just a double of the issue, right? Because the rebound.
Yeah, absolutely. But you're going to get water retention that kind of looks like fat. There's a lot of other things associated with that. But I think what we're talking about is the long-term suppression of estradiol.
Mm-hmm. Okay.
So, we know that low estradiols increase abdominal fat.
Mm-hmm.
And it's counterintuitive, because you go, well, bodybuilders don't have a lot of abdominal fat and they use AIs. But from my understanding, most of the AI use is done right around competition time.
Just about a few weeks before.
Really just to pull water for a little estrogen, because that can help that bloated feeling or look, and you're trying to pull the water and trying to get that dry look.
Mm-hmm.
That's different than like in male hormone clinics, they're giving somebody an estradiol to kill their estrogen for long periods of time.
Mm-hmm.
So we're talking about a long duration without estradiol. That is not healthy.
But Doc, unfortunately, I did have a few women that told me that they were given anti-estrogen for 10 months prior to that competition, which that's why one of the reasons I wanted to speak to you here too, because they are getting potentially harmful information from their coaches that are changing their lives forever.
Potentially, right? So it's, I think that's a long time. I think there's some harm that could be done from that. I think short term, I couldn't recommend it medically, but I don't see where that would cause a long-term problem for short-term use.
Mm-hmm.
But it's that long-term, because think about it.
Because remember, they don't do only one show. They do multiple for many years.
Yeah. So it's a tough sport. It takes its toll. I think, in my opinion, women sacrifice more than men going into bodybuilding for multitudes of reasons. And every female bodybuilder that I know would absolutely agree with that.
Mm-hmm. Right? Yeah. Well, 100%.
So, and the male bodybuilders generally do too.
Mm-hmm.
So that being said, we don't want them to increase their risk for early death, right? Mm-hmm. And that would be my concern, would be the increased risk for coronary artery disease above and beyond everything else. Right?
Yep.
Even when I eat clean and I exercise and I do all, yes, but without the estradiol that protects the coronary arteries by removing plaques from it, it's a risk. It doesn't mean that you're going to get coronary artery disease, but you increased your risk.
The risk.
Might as well smoke. Don't do that. Right? But I mean,
but I get it.
That's a modifiable risk factor, and you could take estradiol while you're utilizing your anabolics to keep a healthier level. And we know the studies are there that estradiol helps type 2 muscle fibers. So why wouldn't you? Why would you get rid of it? I mean, type 2 muscle fibers that's the most dense muscle fibers. So you want to maintain that.
Yeah. Potentially just keep it for a X amount of weeks, and then just like we spoke before, if it's necessary, take it out just a few weeks prior to the show.
I think somebody did that.
Yeah.
I don't know.
Yeah.
Somebody I know did that. I think. Right?
Yes. That's because I have the right advice.
Well, and then I think it paid off. I mean, and that's not taking anything away from your hard training and your diet and everything, but you reached a goal that you hadn't otherwise reached. Multitudes of reasons, but this is another piece of the puzzle.
100%.
One little piece, right?
100%.
It all matters.
Yes.
Right?
Along with progesterone, because what happens when we are on a deficit for so long? We can't sleep.
Right.
If you can sleep, you can
recover.
If you can recover, you can train.
Sleep is the most
important. I was sleeping like a baby.
Yeah. It made a world of difference.
Yes, definitely. So, and then Doc, besides, and I think you were tapping into that too, besides the
amenorrhea.
Yes.
The lack of period.
Yes. But no, besides all the hormone changes that it can be caused by the exercise, and then also the increasing of certain hormones, how about the diet itself? Because I remember speaking to Dom, and Dom always told me that hormones are also made in your fat cells. Is that correct?
Well,
or you need your fat cells for certain levels?
Okay. So I know what Dom's speaking of. So when we are talking about deriving estradiol from testosterone, it only happens through the aromatization of estradiol. And women can do that, the aromatization of testosterone, Women, because they make so much estrogen, but it still has to be testosterone that gets aromatized. And that happens in the ovaries. When you shut them down, that amount of estrogen comes way down. Now what you're relying is the peripheral source of estradiol. And typically, we all have an amount of aromatase in our body, generally in the not the visceral fat, but the subcutaneous fat, and that will convert testosterone to estradiol. So the more fat you have, the more aromatase you'll have, the more conversion of testosterone to estradiol. So as that fat comes down, the estradiol will come down. But typically it doesn't go to zero. It still stays within that normal proportion of about 3 to 5%.
Because where I want to go with this, Doc, is that so we just say that for an athlete that decides to be natural, which is excellent, would that be a lot of risk too? Because now you don't have anything that really supports the at least some levels, because now everything is just down naturally. There is nothing helping with recovery, nothing helping to stabilize somehow the hormones back.
That's a great question, and I'll just be honest, I don't know the answer. But I would think, because if they're natural and they're not supplementing with an outside hormone, they're that lean, they're going to shut down the HPTA access. So yeah, theoretically it could cause some issues. And then think about when these women are doing that, most of them are younger. When you see young athletes, gymnasts or what have you, they get so lean they're amenorrheic. And we can see an effect as they develop from that lack of estradiol. But generally speaking, those athletes are only doing it for a short period of time. Yes, it's years, but it's not decades usually that they can compete at that level. And so that they'll retire from their sport and things will generally come back to normal.
Okay.
If that helps.
Yes, it does. Now, when a woman finishes with their season, their training season, is it important to do any kind of PCT?
I don't think it would be a bad idea, right? Especially if they're considering
fertility
and making a baby at some point in time. And another thought that I had is we're talking about that. If this is your passion and this is something that you want to do, and you also want to be a mother at some time, I would suggest highly considering egg preservation. So go and see a fertility specialist and have your eggs retrieved and stored. So when that time comes, you have young, healthy eggs, because they're aging inside of you as well. And we know that as a woman gets older, it's harder to get pregnant, and the amount of eggs that she has gone down, and maybe the quality has also gone down. So you can harvest them, store them, and if you're 25 years old, those eggs are 25 years old, and now at 35 or 40, when you decide, hey, this is something I want to have a child now, you can go get those eggs. So
that's an idea, yeah.
I think that would be, very beneficial for somebody. But then, at the same time, PCT, so you can get the ovaries back working, turn on that hypothalamic pituitary gonadal axis to get things moving as much as possible back to normal. Ideally, so you're menstruating normally, or at least for a period of time. I know it's so difficult though, right? Especially with bodybuilding.
Yeah.
It's a lot. That's why I say women have to sacrifice so much more.
Yeah.
Because you could potentially be giving up that aspect of life.
Yeah.
Motherhood.
Which is
huge.
We don't want that to we want to be able to make that decision. We don't want the decision to be taken away from us. Right. Because I do know a lot of bodybuilders that don't want to be mothers, but I don't want to be told that I can't. I want to make the decision, say I don't. Right. Now, with that being said, Doc, would you say that the PCT would potentially help with avoiding any drastic changes on facial changes, potentially voice or things like that? Because we are seeing a lot of changes too, not only in an aspect of women growing more muscle, which to me, that's the goal, right? But not everything else changing, and hair loss and changes of everything else.
That's the androgenic aspect of the androgens that are being used in the amounts that they're being used. And PCT is not going to reverse that.
Mm-hmm.
So typically, like we think about a woman's voice when it gets deeper,
Mm-hmm.
what transpired? Well, it's the androgen that thickened the vocal cord. And once it's thick, it doesn't get thin again,
Mm-hmm.
right? So, what some other changes that may come back down? I mean, one of the with the higher levels of androgens, you might see a little clitoromegaly,
Mm-hmm.
right? That can come back down. I tell you, the female bodybuilders I know, they are appreciative of that, right?
Mm-hmm.
Because it's like, oh, you can't miss it, and it's more sensitive, and
Sex drive
is better, right?
Mm-hmm.
So and their ability to achieve climax is improved. So I mean, there's some benefits to it, but for some women that may be a little too much, and so coming off may allow it to come down a little bit, but I don't think it will ever shrink back down to its previous anabolic exposure size. Is that
Yeah.
the way
Yeah.
to say it?
Yeah. Mm-hmm.
There are things that can be done for the hair growth on the face or body, as well as the loss of hair on the scalp, and that's simple as is something like a diuretic, spironolactone.
Mm-hmm.
It works very, very well. It's so powerful that we actually prescribe it for male to female transgender patients to get rid of beards.
Oh wow.
So I'm like, they have a beard similar to mine, and they decide to transition, can get rid of that hair without having to do lasers and things of that nature. So it's very, very powerful. For women, spironolactone for the scalp is like fertilizer. Helps the hair grow.
Yeah, it's the famous aldactone that everybody takes prior to the show for diuretic reasons. What would it be a good dosage to be safe, still not to lose too much water either, because then
50 to 100 milligrams once or twice a day.
Okay.
I think would be fine. So, and it's potassium sparing, so you don't have to worry about that level, and then just, of course, stay hydrated.
Mm-hmm. Is there any particular time too? Like,
well, I mean, if you're doing it twice a day you mean in the
duration?
Oh, I mean, we have male to female transgender patients that are on it all the time.
Mm-hmm.
So I don't see it as a problem for being on it long term.
Okay.
Unless it's causing renal issues. So because it can, but it's lower likelihood. So that'd be a blood test to look at, is, get your kidney functions tested. And, we'll talk about that real quick. You get a kidney function test, which is usually BUN creatinine, not creatine, but creatine can make creatinine go up. And then an EGFR, which is a glomerular filtration rate. Those can go down secondary to high creatine kinase levels. So creatine kinase is released from the muscles when you break it down and work out hard. So a high creatine kinase level can lead to poorer renal functions that may get interpreted by a physician as renal failure, when indeed it's just an effect of the higher CK, or even maybe some dehydration. So another test that your provider can order is something called a cystatin C, and then look to see if that's abnormal, because if that's abnormal, then you might be concerned with renal failure. But if it's not, it's just a sign
that you're training hard.
It's basically a sign you're training hard. It's been affected by the higher CK, right? Or dehydration. So just a little piece of information.
Well, I know people, in fact, a friend of mine went to a doctor and they were very concerned because she's a power lifter. So her numbers were completely crazy, but she didn't know what she was looking at. And she was in state of, alarm.
Well, I made the mistake years ago because I didn't know. And I had a bodybuilder patient, and I was telling him, man, he's an African-American guy. They're at much higher risk for renal failure. And I'm like, man, I don't want to see you on dialysis. Is it worth it? And I had no idea. I didn't know cystatin C existed. So I had to learn this stuff too. And I came from their world. So, and he came to me, and I look back at it and I go, man, I feel bad for giving him that advice, but it was the best advice I had at the time.
Yeah.
And then, that's the beautiful part about medicine is you don't know it all. You're never going to know it all. Keep learning. And that's what drove me into medicine, because I can continue to keep learning and just become a little bit better.
Yeah,
Right.
definitely. And then, Doc, in general, too, would you say that these changes of hormones during any, preparation for any sport event would cause any mental shift?
Absolutely.
And what would they be? Because I know a lot of stories.
Well, yeah.
Unfortunate.
Again, let's just, take it away from the sport for a minute. Let's go to the menopausal woman, right? We were just coming out of a going on 25-year period where we've been told in medicine not to give women hormones for menopause because it increases the risk of breast cancer, which is complete and utter bullshit. And I'm sorry to cuss, but that's the facts. That came from a misrepresentation of the analysis of the Women's Health Initiative. And if you want to know more about it, I have podcasts on it on my site, but we've denied that for women. And we're forcing women to deal with menopause because we didn't want to give them hormones. And what's one of the medications that the primary care gives them? An antidepressant. Here you go. Here's your antidepressant. Here's your cholesterol medication. Right? And you're like, no, treat the underlying condition, the lack of estrogen.
Band-aiding.
But yeah, depression. You get a lot of women who go through the change of life and they think they're going crazy, and they're not. You have more estrogen receptors in your brain than you have a lot of other neurotransmitters. Estrogen is a neurotransmitter. It's a neural hormone as well as a sex hormone. So it's very, very important for men and for women. So yes, mental issues. Do you think that you're going crazy? A lot of women complain of brain fog. I call it CRS. Can't remember shit when they're going through menopause, right? Because of the lack of estrogen. You have to give that back. So as you're already potentially overtraining, you're caloric restricted, and now you're hormonal restricted. Yes, there's going to be some mental issues, right? I know that one of my ex-girlfriends that competed in bodybuilding, we would break up every time that she was getting ready for a show. Every single time.
Yeah.
It was, and it was always my fault, of course. and it was just because of all of the above, kind of having that effect.
Yeah. I mean, I hear a lot of stories, and because they don't have, unfortunately, what I have here, which is potentially have the system of the hormones until X weeks, complete the show, and then get back on the hormonal replacement therapy. They go weeks, right, of that situation where they're having the post-show blues, and then on top of that, there is no replacement of everything that they just lost for so many weeks.
Yeah. Well, you get the best of both worlds, right?
Yeah.
You have a phenomenal coach and fiance,
Yeah.
right, that can guide you through all of that, and he's got a solid foundation of knowledge when it comes to this stuff. And then if there's questions, well, you work with me,
Yeah.
right? And so I have answers too, and then
That's why I'm Olympia qualified now.
And if we don't have the answers, we'll try to find them and we'll figure it out.
Yeah, I love that, Doc.
That's your cheat code.
Yes. All right, so let's see a few more things. Any particular... Okay, we talked a lot about fertility, which is amazing because there were a lot of questions about fertility. But is there any particular PEDs that you know from back in the day that you heard, going to the gyms and being around the powerlifting community too, that you think it's so dangerous for women to be touching, and unfortunately they are? I know some, out there that I heard Trembolone or DECA, NPP, Equipoise, things like that nature.
I think DECA's relatively safe for women per se.
Because it was made for women, right?
Yeah. I mean, I actually had some women in when I first started this that they preferred that over just testosterone. Because it really didn't have the androgenizing effects. It has helped them with their lean muscle and things of that
Helps
nature.
with joints too, right? Mm-hmm.
But you hold water, right?
Mm-hmm.
So, I think it just they're probably pretty much the same. And like when I was competing in powerlifting, one of my favorites is probably the worst thing for you, but I loved anadrol.
Mm-hmm.
I loved it,
Mm-hmm.
and I can't think of the name of it, the chemical name for it, and that bothers me. But it's been so long since I've thought about it.
Mm-hmm.
I don't have to worry about it. But that stuff is just toxic,
Mm-hmm.
toxic to your liver. So most oral anabolics are very toxic to the liver. Anavar in lower dosing is not as toxic. So it doesn't really, it's not 17 alpha alkylated. So it's not as bad. And it's really anabolic with very little androgenic side effect.
Mm-hmm.
I mean, there's just so much out there now. And now with peptides,
Mm-hmm.
there are things coming down the pike that are mind blowing. The anti myostatin and the anti activin A. Wow.
Mm-hmm.
I listened to a podcast. I think you shared it with me, or I shared I know we
Dr.
shared
Mike.
it. Yeah, Dr. Mike. PhD Mike.
Yeah.
He's a very smart guy.
Mm-hmm. Very funny.
And very
Sarcastic.
he's very. I love listening to him.
Yeah.
But he showed the studies on that, and it's just like this is going to be in my opinion, if this comes out, this will be a godsend for all of bodybuilding, because you won't need to use anabolic steroids, you won't need to use derivatives, you won't need to use growth hormone, you won't need to use a lot of the stuff that's out there that has all these side effects. This is just strictly turning off the inhibition of muscle growth that is endogenous in each and every one of us at some degree or another,
Mm-hmm.
and just allow the body to produce muscle,
Mm-hmm.
right? You're going to want to shut it down at some level, but that'll be
exciting.
interesting to see where that goes.
Mm-hmm.
On the surface, it sounds pretty safe. It's got to be probably looked at a little bit more, but
Mm-hmm.
I can tell you I'm excited.
Yeah.
As long as I'm not dead, I'm going to try to continue to put on a
Put
little
more muscle.
And,
Yes,
I mean,
absolutely.
it's our currency for aging, right?
Yeah. Mm-hmm.
And
Mm-hmm. Absolutely. And then, Doc, is there any particular, suggestions that you would give for women that, I guess you can really tell them to stop doing what they're passionate about, and nobody would, and I know you would never
No.
say that, but is there any particular, suggestions, recommendations that you would give these women that are getting information from? Unfortunately, I mean, I'm not here to say that my coach or my fiance is the only one that is knowledgeable. I know that there are people out there that are
there's
a
good
handful,
eggs and bad eggs, right?
but there are quite a few of men that unfortunately are giving a lot of bad information out there, because I get to see their protocols and I'm like, oh my gosh, how dare you? So is there any particular suggestions that you would give to these women to pay attention when they are out there getting information from different coaches? What would it be? Something like, please, just in general, like especially when it comes to PEDs for.
I think, and this is a tough one, because we know there's a dose response curve for muscle growth with anabolics. The more, the better. For the more muscle, the more anabolic, the more muscle, right?
Mm-hmm.
This has been proven out in the science. But
would you also say then, so that does that mean more of whatever you're taking? You have to take more to be able to. Okay.
That's just the way it is. We know this,
Mm-hmm.
right? And it's going to peak at a certain level, but that goes back to the anti-myostatin and the anti-activin A that's going to shut everybody down to a certain level. However, that curve still goes up. And as a physician, my mantra is the lowest effective dose, right? So, you just got to be careful. But I just understand that the more that you do, the more androgenic anabolic steroids that you use, the more potential masculinizing side effects you're going to have. And that's the trade-off. And you get to decide, because
There's no really turning back.
There's a lot, no going back for a lot of these side effects. And you're not, I don't care who you are, you're not going to be as big as you are at 30, 40 when you're 60 or 70, even though somebody you said they were 60 years old and just won a bodybuilding show.
But I would never take her her accomplishment. No, her accomplishment.
Right.
But it wasn't a show that she didn't have a very strong competitions for size.
Right.
Incredible.
Yeah,
but I know what you're talking about.
But at a certain age, I mean, I was 260 pounds. I'm 50, going to be 57. I'm not going to be 260 pounds again, and I don't really want to be. And my joints are like, hey, we want to carry that shit around no more. So what I guess I'm saying is you're making that decision, and it's a lifelong decision for the short-term game. And I understand it, because when I was competing in powerlifting, if you would have said you can bench 700 pounds, and that was a lot when I was doing it, not so much anymore with all the crazy equipment they have, but I was close. I was around 650 pound bench presser. If you said for an extra 50 pounds, but you're going to, die 20 years earlier, I get it. Because I'd have been like, yeah, sign me up. Here we go. Because I'll worry about that 20 years when it comes, but it's not today. So I understand that mentality, but I want to tell you that if everything goes well and you're living a healthy life, you're going to hit 55, 60, 65, 70. And then you're going to look back and go, I wish I didn't do all that.
Mm-hmm.
So some of the accolades, it's a personal decision. I'm not here to pass judgment.
Yeah.
But there's some things that I know personally that I did that I wish I didn't do, because I have to go to physical therapy twice a week just to be able to freaking move, from some of the training I did that I thought was great, I guess that's the best advice I can give, is just know that there's life after bodybuilding, and you want to try to do the best you can, but who doesn't want to win either? So it is not an easy decision.
Mm-hmm.
I would recommend it in your off season. Take some estradiol. Find your doctor. Get on some estradiol. Keep a healthy level of that female hormone in your system. It's not going to hurt you, and especially in your off season, it's only going to help you recover.
Absolutely.
and add more size and a lot of the things, and improve your health long term.
Yeah. And then again, just to clarify for them, if we're adding estradiol, we're also adding progesterone, right?
Yeah, absolutely.
Okay.
Whether or not you have a uterus, I still believe that progesterone should be balanced.
Even without any uterus?
Yeah.
Okay.
100%.
Mm-hmm. And then what would it be, the progesterone action in there? Like, what can you talk?
What does it do?
Yes.
Oh, well, so as you want it orally, oral micronized progesterone, when it goes through what's called first pass metabolism through the liver, this is why oral anabolic steroids trash the liver, because as soon as anything that you put in your mouth and goes in your stomach, your liver has to filter it. Well, micronized progesterone gets converted in the liver to two substances. One of them is 17-allopregnenolone, and the other one is 17-alloprogesterone. There's other metabolites as well, but those two, one of them helps you sleep. And Amanda was just kind of talking about that. Sleep is huge. If you're not sleeping, you're not recovering. That's probably one of the most important aspects of training that people overlook, is sleep and recovery.
Definitely.
And then part two of that is it has an anxiolytic or an anti-anxiety calming effect. And so if
anxiety is through the roof when trying to preparation.
So, it just keeps you a little calmer. It doesn't mean that you're going to go in the gym and you're going to be meek, because you can still turn it on in your brain, but you don't want to be in a fight or flight response all the time. That's not beneficial for growth either.
No.
Right?
Yeah.
So.
Okay. So again, a little bit of testosterone, estradiol, and progesterone.
Yeah. It's almost the same thing that we do for our women in menopause.
Yeah.
Right?
Yeah. And then potentially even armor too, right? Depending on.
Well, no. We use NP thyroid, because
that's right.
Armor thyroid, from my understanding, has gluten in it. So people with gluten sensitivities, I actually have a patient that's the only thing I changed for her. She was on Armor thyroid, and she was having problems with her weight, and she couldn't figure it out. And she came to me, and I said, well, do you have gluten? I can't handle gluten at all. I'm like, well, let's just change from no dose change. Just change the manufacturer from Armor to another manufacturer that doesn't have it, NP thyroid. And I don't get paid by anybody. Put her on the NP thyroid. It changed her life. I mean, she's able to lose her weight, and still maintain the benefits of thyroid, and everything worked out.
Wonderful. Yeah.
So
I say that because then would you say that if we improve our thyroid, then potentially we increase fat loss too?
Well, if the thyroid needs addressing.
Oh, okay.
Right. So if you have a hypothyroid condition, then absolutely.
Which seems to be very common nowadays.
Yeah.
Yeah, I hear that a lot here.
Yep.
Okay. Well, Doc, this was amazing.
That's it.
Yes, I feel like we
covered it all.
We spent over an hour here speaking already.
It hasn't been an hour, has it?
Yes, it has.
No.
But I will be happy to come back because I'm sure I'm going to have more questions and more things that's going to come out from this episode. I will also use this episode for your own podcast if you don't mind.
Absolutely.
We can add it there because I'm sure people will be happy to see. I feel like that is a very organic search for your podcast because I see people from so many different parts of the world even clicking there. So I want to dig a little bit more into the data where it's coming from.
Yeah.
But I will definitely add it there too. But then whatever questions that they have, I would love to continue this with you because back in the day, Dave, he takes care of J Color TV. He used to have one called Ask the Doc. It was insane. Everybody in this industry and their mothers had questions. So I think that would be cool if maybe we come back with that if you have time, of course.
Happy to.
Yeah.
Happy to.
To ask more questions because like I said, there are a lot of people out there that have questions, but they don't even know how to ask those questions because, for instance, if it wasn't for you or for Carrie, I don't think I would speak to anybody in the medical field about what I do in bodybuilding.
Yeah.
It's
because a fear of being shamed.
Yeah.
Right.
I always tell this situation. I remember when I had never touched testosterone, but I was assuming that my testosterone was high from all, the exercise and extra protein that I was eating back in the day. But I did a testosterone test, which was so difficult for me to be even tested for testosterone in LA. And the person who was helping me asked me if I was transitioning because it was much higher than she ever saw, which I don't think it was that high, but it was, higher than she ever saw. I'm the kind of person, I have a very thick skin. Brazilians are very much like New Yorkers. But I think it's funny because it happened so many years ago, maybe probably like 7, 8 years ago, but it just hit me a couple days ago or a couple months ago. I was like, I remember somebody asking that question. I'm like, wow, that's how it hasn't been that long that we progressed so much to now women talking about hormonal replacement therapy and how important it is. It was just about a few years ago people thought that, and I'm sure it's because I am around very intelligent and amazing people, so I think that this is the new world, but I don't think it is.
It's bodybuilding is a very, very small segment of the population, and it's a family, right? And so the people that know, and the people that don't, well, what do humans do when they don't know about something? They generally look down upon it or shun it, or have some derogatory comment or something. I always laugh and guys say, "Oh, that girl's too big" or something like. Well, if you were a man, then you wouldn't be intimidated by a female. So
yeah, it doesn't matter how big or how tall or how strong she is.
It's I'm impressed when I see a female athlete. I'm like, good for you. Yeah, right? Just keep it up. So,
yep. But thank you so much, Doc. Like I said, we're gonna definitely come back with more questions, and I'll share with you what everybody said about this. For very first episode.
Looking forward to it, and I'm looking forward to the questions that come because, maybe make me do a little research too, and I like that because then I got to learn something. So, thank you.
Thank you.